In this comprehensive script, we will delve into the intricate details of pulmonary valve regurgitation, a condition characterized by abnormal blood flow from the pulmonary artery back into the right ventricle during diastole. Throughout this script, we will explore the pathophysiology, diagnostic modalities, hemodynamic consequences, imaging techniques, surgical management, and long-term implications of this condition. Additionally, we will discuss specific considerations in the context of congenital heart disease and pregnancy. By the end, we hope to provide a thorough understanding of pulmonary valve regurgitation and its clinical management. Pulmonary valve regurgitation occurs when the pulmonary valve fails to close properly, allowing blood to flow back into the right ventricle during diastole. There are several underlying mechanisms that can lead to this abnormal blood flow. These mechanisms may include congenital defects, such as pulmonary valve malformations or bicuspid valves, as well as acquired conditions, such as infective endocarditis or rheumatic heart disease. Understanding these mechanisms is vital in comprehending the etiology and progression of pulmonary valve regurgitation. The diagnosis and evaluation of the severity and extent of pulmonary valve regurgitation heavily rely on various diagnostic modalities, with echocardiography playing a central role. Echocardiography enables the assessment of regurgitant jet characteristics, regurgitant volume, and right ventricular size and function. This topic will provide a detailed overview of the echocardiographic parameters used in evaluating pulmonary insufficiency. Long-standing pulmonary insufficiency can have significant implications on right ventricular function and can ultimately lead to the development of right-sided heart failure. In this section, we will explore the hemodynamic consequences of chronic pulmonary valve regurgitation, including the alterations in pulmonary artery pressure, right ventricular afterload, and ventricular vascular coupling. Understanding these consequences is crucial for effective management and intervention. Cardiac magnetic resonance imaging, MRI, has emerged as a valuable tool in assessing the severity, progression, and potential complications of pulmonary valve regurgitation. This section will discuss the benefits and applications of cardiac MRI, including its ability to provide detailed assessments of ventricular volumes, regurgitant fraction, and the presence of associated pathologies, such as right ventricular outflow tract aneurysms. Surgical intervention is often required for the management of severe pulmonary insufficiency. This topic will provide an extensive exploration of the various surgical approaches used to correct pulmonary valve regurgitation, including valve repair and valve replacement techniques. We will also discuss the indications, outcomes, and potential complications associated with these procedures. Chronic pulmonary valve regurgitation exerts significant changes in the structure and function of the right ventricle. This section will delve into the structural and functional adaptations that occur in the right ventricle in response to chronic pulmonary insufficiency, including ventricular dilatation, hypertrophy, and impaired contractility. Understanding these remodeling processes is crucial for long-term management and prognostication. The association between pulmonary valve regurgitation and the development of chronic thromboembolic pulmonary hypertension has been well documented. This topic will explore the underlying mechanisms linking these two conditions, the diagnostic approach, and therapeutic strategies targeted at managing chronic thromboembolic pulmonary hypertension in the context of pulmonary insufficiency. In recent years, transcatheter interventions have emerged as minimally invasive alternatives to surgical management in select cases of pulmonary valve regurgitation. This section will investigate the various transcatheter procedures used to treat pulmonary insufficiency, including transcatheter valve implantation or repair techniques. We will analyze the indications, outcomes, and potential complications associated with these catheter-based interventions. Evaluating the prognosis and long-term implications for patients living with pulmonary valve regurgitation is essential for providing comprehensive care. This topic will focus on the outcomes, lifestyle modifications, and ongoing medical management required for patients with this condition. We will discuss the importance of regular follow-up, monitoring of ventricular function, and potential interventions in mitigating adverse outcomes. Pulmonary valve regurgitation frequently coexists with various congenital heart defects. This section will explore the occurrence, etiology, and management strategies for pulmonary insufficiency in individuals with congenital heart disease. We will highlight the unique considerations and challenges associated with treating pulmonary valve regurgitation in the context of complex cardiac abnormalities. Identifying clinical and hemodynamic variables that can predict the progression and outcome of pulmonary valve regurgitation is crucial for patient management. This section will elucidate the prognostic factors associated with pulmonary insufficiency and their implications on therapeutic decisions and long-term outcomes. We will discuss the role of exercise testing, cardiac biomarkers, and other prognostic indicators in assessing disease severity and monitoring disease progression. Managing pulmonary insufficiency during pregnancy poses unique challenges and considerations. This topic will analyze the impact of pulmonary valve regurgitation on both the mother and the fetus. We will explore the potential risks associated with pregnancy, optimization strategies for maternal cardiovascular function, and the role of multidisciplinary care in ensuring optimal outcomes for pregnant patients with pulmonary valve regurgitation. In conclusion, pulmonary valve regurgitation is a challenging condition that has significant effects on the heart and patient outcomes. We have covered in-depth topics like pathophysiology, diagnosis, treatment, and long-term care to provide a comprehensive resource for medical students and healthcare professionals.